Hi, this is Amy Campbell, and I am a lobbyist at the Capitol.
Hi, everybody. I'm Bill Kallestad. I'm the Public Policy Manager with the Iowa Developmental Disability Council.
And Bill and I are going to be doing these weekly Monday Capitol Snapshots for you all to kind of get a flavor of what's going on at the Capitol. Each week, what happened the week before, what happened the week after. So you're probably asking why we're doing one now. We decided to practice.
Yeah, have a practice and give an opportunity to kind of tell what's happening right now. There are still some events happening in December. We know that they're going to be evaluating some things to do with the budget. And then also there might be some other meetings that we're kind of watching closely. So we just wanted to give a chance to test out our weekly updates, but also kind of give you guys an idea of what's happening.
Yeah, one thing that's happened this last week, just a couple days ago, was a group called the Revenue Estimating Conference, which they shorten it to REC, met, and that's a group of 3 people, and they look at how much money the state's bringing in taxes, so that they can figure out how much the legislature can spend in the next year. So when the legislators come back in 2022, they're back January 10th, they will know how much they're able to budget for each year. And so one of the things we wanted to talk about is these sheets. I don't know if you can see them. They're really complicated. It's really hard to read them. I've been doing this 30 years and I'm not very good at interpreting those. So we thought we'd just explain what exactly it all means. So when this group met, they looked at how much money was coming in taxes, and they estimate that we're doing pretty good as a state. In fact, it looks like we're going to have $260 million more than what we have in the current fiscal year to spend.
So they're really trying through this conference, I know it's repeating the title of it, but they're trying to estimate how much revenue they can have. And that's kind of important, I suppose, because a lot of things get determined. Once you determine what your revenue is, then you can start to look at your expenses, right?
Right. So it's like your checkbook at home. You don't want to spend more than what you have in the bank. So that's what they're basically doing, is predicting how much money they're going to bring in from July 1st of this current year to June 30th of next year. And so what they're doing is they're just kind of guessing this year's and then next year, from July 1 of 2022 to the following June 30th. So they're looking at 2 years at a time, and not only does this year look good, next year looks even better.
Yeah.
So what's interesting is the governor's office came out right away and said we're overtaxing Iowans. To have this amount of money coming in over what they've spent, they don't think that's fair. So I'm guessing that we're going to have a lot of talk about tax cuts this year.
Yep. And I think it's really important as advocates and self-advocates to make sure you're aware of the process. So first they usually have the revenue estimating budget, and so we find out what a revenue is, and then usually after that the governor sets her budget for the year, and then the legislators report to duty, and at that point they're going to start to decide what bills can be supported under that budget. And so the health and human services budget, definitely where funding for services are provided, but also prioritizing some of the most important laws that we're wanting them to consider, whether that's addressing the waiting lists of people who are not being served, or whether it's to look at wages of people that are working in the field, or even the rates that people are reimbursed. And so if you think about it in steps, you have the estimating conference, you have the governor's budget, and then the legislators start to make some decisions based on that. So it is important to know the process, but also to understand that there is a surplus, and as advocates then asking for that surplus to be spent in an area that's important to you, or at least then let your legislator know what your priorities are.
Yeah, I think that's really important, because the governor has to, by law, plan her budget and her priorities around this number that they estimated just a couple days ago. And so it's about a $9 billion budget, billion with a B. And so it's a lot of money, probably not as much when you look at some of the bigger states, but that's a lot of money. But we also know that we have a lot of money in the bank. The state has done well in saving money. So we've got almost $1 billion in our, what they call the rainy day fund. And we have used it on rainy days in the past when we've had kind of the economy slow down. And then we also have $750 million that we didn't spend at the end of last fiscal year. So there's a lot of money sitting there. The question is, as Bill said, how are your lawmakers, your legislators going to spend it? And one thing we know is some are going to want to not spend it and give it back in the form of tax cuts.
Yeah, and there are a lot of priorities, and there are other advocacy groups that also have a special interest of what they would like to advocate to. So it is really important to kind of share your message of what you think is a priority and also what is a solution. So like when we talk about the waiting list, knowing what the number of people who are on the waiting list, which is a little over 1,200, and that what services are important to them. That's a really good connection for that. And then how can they fund that? And that would be a connection to the Health and Human Services budget. But there are other advocacy points that we're also really aware of when it comes to the field of people living with disabilities. So just really important to understand there is a surplus, but there will be other advocacy groups asking for them for consideration. And so this is an opportunity to share your message.
Yeah, a big one's going to be education.
Yep.
Education always takes the first chunk of the budget. They get between 1% and 2% increase each year. But when you talk about raising reimbursement rates, paying direct support providers more, clearing the waiting lists, all of that costs a lot of money. And so you can see that if you don't talk to your legislators about why that's important to spend the money we do have on those types of things, it might be pretty easy for them to just cut taxes. So right. I think that's important for advocates to know, is there's going to be a tension between a push and a pull between those that want to cut taxes and those that want to fund the programs we're not really funding very well right now. And it's going to take a lot of calls and emails from advocates to change that, change how that discussion's happening. So hopefully people will do that, Bill, because we've got a great resource on infoNET's website, don't we?
We do. Yep. And I think it's really important to think about as you're considering those areas, your talking points. And so just a reminder that when you think about, Amy just mentioned that the direct care wages, but that also could infuse them with some training that's necessary, some certificates that would help them to do their job better. Really important stuff. And so you can find on our infoNET, whether it's our legislative priorities or the bills that are being tracked, or even a little more in-depth information about the current things that have happened, whether it's when we find out the outcome of the rec meeting and there's some more data there, you'll be able to find some of those links there, and maybe you can interpret those a little bit as well. So
yeah, so I think what we wanted to leave you with today was that the state's budget's doing pretty well. Legislators are going to have choices this year on how to spend the extra money they have, and I think it's really important that if you have if you think they should do something with those dollars, now's the time to tell them. And
I think, Amy, you just gave me an opportunity to mention this earlier, and I kind of, as I was thinking of a different point there, if you go to the infoNET site, www.infonet.org, you can find your legislator there. And there's an easy way to find your legislator on that website, and then once you indicate that, you can send them a direct email from that site, or you can at least get their email address. Another thing that you could find there is our guide to the legislator. You can find out what committees are considering some of those important decisions. So like Amy said, this is a great opportunity to at least reintroduce yourself as they get back to the office.
And we will put a link on this video to show you where you can find another video on how to use our Action Center, because it's a really easy process to Just type in your address and it'll find your legislators for you, and you can either use one of the messages we've already written, or you can choose to write your own. And I really encourage people to write their own message. You don't have to say a lot, but those personal stories are so important. So if you want a legislator to spend dollars to eliminate the waiting list for home and community-based services, maybe if you're on the waiver waiting list, you can talk about what that means and what it would mean if you were taken off the waiting list and actually started receiving those services. So those are the types of things that help legislators understand what the issue is, rather than just looking at a piece of paper with numbers on it. The stories really tell the story.
We hear it time and time again. It's the personal stories that make a difference, that start to kind of initiate some of the laws that they consider. So please share your story.
And I think we wanted to end this with, it's really important that we talk about investing in home and community-based services, because you probably heard that the Department of Justice, the U.S. Department of Justice, found that Iowa is not in compliance with the ADA. We are not giving people options to live in the community. We're just too heavily institution. And, that means money to build that capacity in our local communities.
Right. One of the driving forces of the Iowa Developmental Disability Council is to make sure that people have the resources to live in the community that they choose to live in, so they can live and play and work in those environments, be contributing members. And so the Department of Justice certainly had their impression that Iowa was not where they need to be, and I think that's supported by DHS and some of the information they have. I think they're building some infrastructure to be able to support people in the community, and we just want to take that momentum and move that forward. And so that is another large opportunity to advocate for community-based services, whether that's services in your hometown or transportation or education or making sure that you have the right resources and staff available there. That's a really great opportunity to kind of look at that information. And again, you can find more information on that Department of Justice hearing on our website, where you can kind of link into there and find out what some of the findings were, and maybe some of the advocacy points that you can stress.
Well, hopefully that wasn't too painful for our audience as they suffer through us doing our first official Capitol Snapshot. Maybe by February this will be old hat and we'll be pretty slick news reporters.
We'll get a different background. We'll keep spicing it up. So
well,
please
thanks,
come back.
Everybody. Hope you have a great holiday season, and we'll see you when session begins after January 10th.